a number of things I'm curious about. I guess that probably defines me as much as any trait, maybe other than impatience. But I'm curious about what tools are synergistic with psychedelic medicine to bring about healing. And I think we can talk about, nutrition and making the body a less inflamed place and bringing diet into balance. I think those things give us more depth and traction with psychedelic medicine. But I'm also curious about things like, does TMS create an enhanced neuroplasticity option? What kind of spiritual practices as a prelude to psychedelic medicine, whether it's chanting or singing? I've been really profoundly intrigued with vibroacoustic beds and other sort of modalities that may just help us drop in a more deep way.
Welcome to the Too Curious MD podcast. I'm Dr. Ali Ahmed.
And I'm Dr. Soraya Arfan.
With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in. Welcome to the Too Curious MD podcast, where medicine is more than science. It's story, art, connection, and integration. And this is a space for the curious. Let's dive in. Today's guest is Dr. Scott Shannon, a pioneer and integrative psychiatrist and whole person mental health care advocate. He is a psychiatrist, an educator, and author who has spent decades exploring how mental health can be treated through a broader lens, one that includes not only medications, but nutrition, lifestyle, relationships, meaning, and most of all, spirituality. His work challenges us to rethink the boundaries of psychiatry and consider how healing emerges when we address the mind-body story of a person together. I hope that in this conversation, we'll explore the evolution of integrative psychiatry, how lifestyle medicine is reshaping mental health, and why curiosity, our favorite word on this podcast, brings meaning, maybe some of the most powerful medicines we have. So welcome, Scott. How are you?
I am well today, thank you. As I was telling you, we had a snow last night, so I woke up to a winter wonderland, which has been nice on this dry winter, but happy to be with you both this morning.
Thank you. Well, we have lots of questions, and I'm going to ask the first one, which is really about how does mental health, how do you feel has evolved from your journey, and why isn't conventional models alone enough in your experience?
I think it's interesting. It's sort of journey in the journey of conventional care, and it's like they're coming together. I think I've always been a bit of a rebel and an iconoclast and have always felt a bit outside the frame. But I guess if you just persevere long enough, maybe the frame will come around to you. So it's been interesting is that, I used to tell people that I only have two concerns about modern psychiatry. The first is the diagnostic system, and the second is the treatment system. Other than that, I'm pretty good with it. But so just getting back to the diagnostic system, the DSM felt so narrow, so limiting, so damning, so not respectful of people's potential and not understanding why their context was creating such a challenge, a drag, a distortion of who they are, and just really not understanding that we live connected, deeply connected to so many different systems and ecologies of body, mind, and spirit. And it just never resonated with me at all. And now I'm just reading this morning that the APA is reconstituting the DSM, renaming it, trying to make it more systems-based. I think it's a first step, but I think everybody realizes that we're not going to get very far in our modern psychiatry with the way DSM is so superficial, phenomenologically based on symptom patterns. I heard some people describe it as modern psychiatrists are gardeners and not botanists. is that we just group things by red flowers and green flowers, and we don't understand the deeper underlying structure. And I think, as part of that, we've been doing brain maps and QEEGs at our clinic for the 15 years that we've been open. And we're now seeing that aligned with so many things that we use it for treatment planning, diagnostic sort of sorting, if you will, trying to become a little more of a botanist. And now I think pretty strong evidence. There's been a recent paper about TMS that's guided by QEEG is achieving response rates that are just unheard of. So it's trying to move us in the direction of personalized medicine, precision medicine. And then the treatment system, the other half of that, I just have never felt fully engaged or a part of the sort of psychiatric medication paradigm. I participated somewhat unwillingly, ambivalently at the very least. And, even in the height of the Prozac sort of launch hysteria in the late 80s and early 90s, I had a sense that these were partial solutions, but they were often as much a distraction and even perhaps a drag on people's innate resilience. And so as at that point, I got trained in acupuncture, and at that point, I sort of dove more deeply into nutritional medicine and herbal medicine, looked at homeopathy, just exploring different pathways, trying to find a fit. I think ultimately all of these things help to some degree. And the last 10 years have been coming around to sort of where I started, which was with psychedelics. I started with Andy Weil at the University of Arizona in the 70s, and psychedelics were always a strong theme, subnote, discussion, interest. We had probably 20 medical students who were in Andy's circle and, just finding out about MDMA. So that after I graduated from medical school in 82, I went and did an internship. I just had to get out of and practice, and started working with MDMA in my practice and other tools, such as acupuncture. I worked with Gladys McGarry in her clinic, and she was just a wonderful mentor and guide and inspiration. And ultimately then went back to psychiatry when my tank was a little more full and I had a better sense of what I wanted to do. But it's interesting in terms of the treatment modalities that we're finally coming around to psychedelics now. I think 40 some years after I graduated from medical school, and it does feel fulfilling. And I guess there's some value to being patient as well. And that's not a strong suit that I have really at all. But at least it came around to me. I guess if you stay busy long enough, things happen. So a roundabout trip, but I feel like both the diagnostic system and the treatment system are coming around. And I think we are getting closer to a true systems-based approach to mental health that honors body, mind, spirit. And it's really my feeling that, we started with holistic medicine. It came complementary and alternative medicine. It became integrative medicine. And now we have systems medicine, systems psychiatry. Interestingly, Andy Weil and I just co-authored a paper on the need for a systems psychiatry. And fingers crossed, it should be published soon. And it just feels like it's coming around. I'm hopeful that 30 years from now, it's just good psychiatry, and that we'll see a blending of the reductionistic and the holistic models, the left and right hemisphere, so that we can have a full head and approach this not half-assed. So that's my thinking.
I'm going to ask you a question related to kind of hopefully everything that you just summarized here, your life story, and I'm sure the depth of that is so much more richer. The coming to of your belief and how that comes together. One is that you don't accept the status quo and the reductionistic approach to how we see people, that people are more than just a label, and the element of their existence isn't just a condition, and how the application of those conditions can be met with natural ways and alternative thinking and resourcing outside of the box of what's presented to us as physicians, as in our training. And then I know you talk about spirituality in your work, but I feel like that is an ignored process in medicine, completely left aside, especially in America. And the belief that I'm hearing from what you share is that the technology, the application, the diagnostics of science can still play a big role in how we see a condition instead of it being a prescription. It is uncovering, kind of applying that into practice. And you also teach, and you also have trained and also write books. So I feel like there's the story of your sharing to what you know and what you uncovering as you go in your life comes out through what you just shared. So really appreciate you providing that whole context of kind of this process that I feel physicians are really maybe they don't have the time to kind of sit with that or even to sometimes consider that. I mean, me and Polisemi both kind of came into this practice of medicine, and you hear this from other physicians because of the extreme burden and trauma that we're exposed to, but we're unable to process ourselves. And I will say this as a pediatrician and a hospitalist working in the deep trenches, not just in America, but in the global arena of care where we were providing care in really tough situations across the world, and how the basics are so much more, there's such value in just the basics of just listening, of just being present with, and the kindness and the trust of being a physician is palpable. Even when I've come back to America, just having that opportunity to be present with, of course, you're taken away from that role in so many different ways in the Western healthcare practice. And I feel that's the struggle that we're all in medicine, patients included. And you hear this over and over and over again. Patients are being told this or that. They're given medications. I came back to America 10 years later, and I'm seeing children on 4 or 5 psychiatric meds. And I'm seeing their guts, like this stark change is so dramatic. And I was really taken aback by how challenging and how the suicidal rates had increased, and children were just overdosing and lost. And one of the reasons I went to do medicine was to really try to understand how, as a physician, do we first process our own trauma in that experience, but how can one really help our patients with some of the methodologies of just listening, of just paying attention to the story of a condition. So I'm speaking, I know a lot, but I'm really connecting to what you're sharing and the experience that you've really opened that pathway for a lot of people. So thank you for that.
Well, your experience is not so unique. I think most of us as healthcare professionals have felt beaten down, desiccated, I think is in some ways the best word, by the system that doesn't support our wholeness or the wholeness of the people that we treat and care for. And as a result, we have burnout rates among hospital-based physicians that are 40, 50, 60%. We've been doing a program at our clinic, which is group ketamine for professional burnout. And what we find is that it's just enormously helpful. And there's people tell us that there's not been a systematic approach to help them process trauma and sort out meaning in their lives as professionals. And, we were particularly working with ICU folks, emergency department folks, first responders, paramedics, even police and fire. And what we found is a real uniformity of experience is that in a reductionistic model that doesn't recognize our spirit and the spirit of those people that we care for, something grave is lost. And we can provide the mechanics of care, but everybody is suffering as a result. And that's because the system has taken on an approach that doesn't value who we are and doesn't value what we need as humans. And that's humans providing care, humans getting care, humans suffering. We're all suffering. And what we realize doing this work with the group ketamine is that when we can come together in community and open up a space that's vulnerable, that's sharing, that's confiding, that's safe and respectful, people share deep, deep pain and they feel better after they do that. And I think that just speaks about the relational foundation of who we are as human beings, and that we need to have this honored, respected, validated, and factored into the work we do. If you're just providing widgets and care units and what's the hospital term, BCU or
RVUs.
RVUs, that's it. It has become so much about RVUs and not SVUs, spiritual value units.
Right.
So, yeah, I resonate with you. And it certainly was the case for me, is that I became so depressed through medical school that I really thought about going into teaching and applied for teaching jobs coming out of medical school. And at the last minute, when I was deciding between a teaching job and an internship, I was talking to my dad, and he gave me a word of wisdom. He said, you're very torn about this, but if you go and follow the teaching path, you won't be able to go back into medicine. If you go into medicine, you'll always be able to jump back into teaching. And I really found an internship that I resonated with in a rural area, and it held true. I got recharged, did a year, paid my dues, went out and practiced for 4 years following my heart with Gladys McGarry and just following healing modalities that seemed more resonant, body, mind, spirit connected. Then I could go back to a psychiatric residency after that and carry my truth with me. And so that's been the challenge, I think, for all of us, is to carry our truth with us and not get so beaten down by the system that we give up and we give it away.
I find the example that we're bringing forth with the story of your life, where it started even as early as medical school, this questing for there's something better. And you mentioned impatience. And I know that this conversation will land with a lot of young, medical students and interns and residents who are really struggling in this system, which, believe it or not, has actually gotten worse in the 40 years that we've been in practice. Private equity has taken over hospitals. The TV show The Pit is slowing down our shifts to show us the depths of what is happening in our healthcare system. And we are shocked. People are realizing for the first time what's been hidden behind some of these silos and barriers. And with that democratization comes this kind of understanding that no more, and you've had 40 years now of, questing, finding your own path, really making that resiliency within yourself to make it through to what you knew was the right way to do things. This knowledge, right? I really resonate with what you just said, is find your truth and live your truth as a message to people who are afraid of entering, I can imagine right now being a medical student and, kind of looking at what the practice of medicine is. And so many people are leaving medicine. The expertise is kind of, the layer of expertise that's, you talk about this whole system of reliable data, information, leadership, medicine. That is all just kind of crumbling, right? With all the ways that our system is moving towards. We could have a measles epidemic here in Los Angeles and very few people would know about it. We're in this space where being a physician has kind of ratcheted up to exactly what you're saying is, if we can connect with our truth, if we can build resilience in these communities of practice. I love that paper you put out about PTSD in healthcare workers. If we can build that resilience, and then we have a chance of changing this around, of turning this around, because the people in the middle will have the ability to do exactly what you did, which is remain curious, open up to other ways of thinking, and listen to our patients. Kindness, respect, generosity, community, right? Like all these things that you've been holding for this long, and just to kind of see it all come together. And also that underlying piece of psychedelics. Like, I think we forget that the path here must have been really circuitous. But here now, looking back, does it all kind of make sense? Like, does it all kind of just kind of connect? Like, oh, that's why I did that. That's why I did that. Oh, now it makes sense why I followed that. These were subconscious or unconscious inklings that you might have had, but now in the kind of, hindsight, are kind of bringing it all together. Because I feel like psychedelics and physician burnout, if you'd asked me 5 years ago, are those two things parallel to each other? I'd be like, no. But here you are doing this for 40 years and have lived that truth. So can you just share a little bit about what that means for that to be confirmed in such a way?
Well, I think in many ways, in simplest reframing, psychedelics are opening us to spiritual medicine. And, 10 years ago, when I was a few years into my practice at wholeness, I just felt like we did body pretty well. We were beginning to understand functional medicine. We had sense of gut and microbiome, some early things. And we were looking at inflammation. And there were a lot of things that we were starting to understand about the physical side of medicine. And on the mental side, we had mind-body approaches. We had meditation. We had psychotherapy, which I think has always been a piece that can speak to us very deeply. But I felt like there was nothing that I saw about spiritual medicine that was really validating or resonating so much in all of integrative, holistic medicine. We gave it lip service, but it wasn't a tool that we could effectively use or did very often because most people had some level of discomfort with it. And, it had a bad rap because of dogma, and there were a lot of things. People had a lot of religious trauma in their life that they were carrying as baggage. And so I think it was just treated a little bit like the red-haired stepchild of the body, mind, spirit triumvirate. And that what I saw with psychedelics, and I began to understand it and sort of was pulled back in because I had let it go for about 20 years. I really just saw that it was validating the spiritual side. And it called to me personally because I think I was going through my own spiritual crisis and deepening of a search for meaning and a search for what I needed to follow. And it was calling to me. And so I circled back to it. And I really just see it as a blossoming and validation in ways that modern medicine and modern culture can accept. And it's just very interesting how we're having a psychedelic moment in our culture over the last 3 to 5 years. And there's a hunger for it. We have religious churches. I think there's 20 or 30 psychedelic churches in Austin, Texas. We've got a dozen in Denver. It's something happening. And then there's this underground movement. And then there's state regulatory. There's stuff going on in 40 different states now around psychedelics. And then we have the whole medicalization, the MDMA, the Compass, the MAPS, Lycos, et cetera, worlds where we're pursuing. And so there's all these different pathways that are moving in the same direction because of this spiritual hunger. And I think a profound reckoning where our culture is just reacting to the pendulum swing of 400 years since Galileo, where all that we have valued is that which can be measured. And you can't measure purpose, meaning you can't measure love. You can't measure compassion. You can't measure relationship. And these are the sort of most intrinsic core parts of our being. And we've developed a science, we've developed a healthcare system, we've developed a materialistic, commercialized culture that is absent all of that. And people are responding by finding something that can answer that call. And we know that call within. And I think when we can get in touch with our heart and our intuition and our deepest sense, that it leads us in the right direction. I think that's what's happening now across our culture. And I think that's just been the path that I followed. I don't think there's any innate wisdom to it. I think it's just what I had to do.
Mm-hmm. I'm finding that with patients, when they come in critically ill with, complex diagnoses and layered upon layered, and then the comorbid factors of their condition, their body health condition, the trigger points that show up on every day, the construct of how they're living their life in their condition. And you take off those layers and those layers fall away with treatments and ketamine and just having therapy and connection. What I find more and more of in my patients is that sense of meaning, that sense of purpose starts to show up. And sometimes it's like there's a direction towards an idea of purpose, and sometimes they're lost in that, that hope of purpose, or they don't even know what that would look like.
Yes.
which to me is the challenging place because of the way things are happening in the world as we speak. And you can treat somebody to the point, yes, they can sleep better, they can get better, they can start focusing on their health. But when it comes to purpose and they've lost their way or don't know a new way, what have you seen in your experience that helps move them through that space?
Well, it's interesting. I read a lot of John O'Donohue. I don't know if you know who John O'Donohue is, but he wrote a book, Anam Karam, but he's got some other beautiful works. And he talks a lot about suffering and how suffering is a call to touch the soul and to touch the deepest part of ourselves. And that often opens up an awareness about what is missing, what is real, what is important. And it's obviously nothing that we wish for, but it often comes to us and brings us these messages and brings us these opportunities and choice points where it forces us to slow down. It forces us to simplify and reckon with the basics. It forces us to contend with our own mortality and our own limitations. So I think it does represent an opportunity, just like I think end of life represents a glorious interface and opportunity with psychedelics because they are very useful for opening up this existential basket that we can explore and begin to embrace and understand to some degree, come to terms with. So I think, I think the more that we deal with chronic illness, the more we deal with life-threatening illness, the more we deal with the complexities of mental health, those all, I think, represent opportunities to deepen the discussion and the dialogue. And I think there's nothing as powerful an intervention as spiritual medicine that's well placed.
Beautiful. I'm feeling a real empathy for the human experience and the fact that most of us may go through life never having even questioned that this even exists. There's this real dearth, as we've mentioned, this desiccation. Yeah. And you mentioned that these are not measurable, like you said, like how do you measure meaning and how do you measure purpose? And I love the word spiritual medicine. I've heard of consciousness medicine, there's psychedelic medicine, but this is spiritual medicine. And this is one of the places which we try to cross over into when we're talking to patients who have never talked about psychedelics, never dealt with it, but now are being brought to it because they have a mental health condition that may now be helped by psychedelics. So when you're first talking to somebody in that way, and this empathy kind of opens up and this curiosity, right, for their experience, and you're actually giving them the time to tell their story. I mean, one of the reasons I think, Alia, you and I went into narrative medicine is, Dr. Rita Sharon, who wrote one of the books on narrative medicine, said that physicians will interrupt their patients within 18 seconds of, them talking. And so that's the system that we work in. And we're really trying to move it towards where we see the human as worthy of connection, attention. And that is such an unfamiliar place that I feel like that is a lot of the work we have to do, is to convince people sometimes that they are spiritual beings, that sometimes the fear of going into the psychedelic space comes from that desiccation, right? And I think of a sponge that's so desiccated, there's no juice there. So how do you believe you're more than if there's nothing there, right? So when a person comes to you, and, we're all practitioners and we've all dealt with this, but, from your experience, how does that change happen? And how do you, invite that change to happen without that labeling, without that you must do this, because that's that place of gentleness that I'm feeling. Is it would be so easy for the psychedelic world to just turn into like more of the same. Here's the pill, here's the magic, go do it. If it doesn't work for you, sorry, it's not our fault. This idea that we're talking about non-responders, right? Even in ketamine therapy, just again, more of that labeling language, right? Instead of saying, well, what's going on here that's getting in your way? Are you getting in your way? Is something in your life getting in your way? And so if you could just speak to that process of what it's like to bring that person back to themselves and how you approach it.
Well, I think one of the biggest things, you mentioned just listening. Sometimes it's just listening. But I think it's being respectful, appreciative, and supportive. It's no surprise that most of us grew up with less than ideal parents. And I think we're always looking for that positive reparenting. But I think, in many ways, our spiritual self is like a child. It's like I don't know if it's a toddler or a rebellious adolescent or whatever it is, but I think it's a part of ourselves that because the culture does not respect it, because our healthcare system doesn't validate and honor it, that it is often an insecure, introverted piece of ourselves. And because of that, I think it needs a lot of validation, support, encouragement to blossom and come out, and helping people to know that even though these areas are often uncomfortable, that with love and support, they can be very valuable. I don't know that there's any real magic to it, but I think just being loving, supporting, accepting, listening, receptive. I think anytime we're trying to set the agenda and have a message to deliver, it creates a different atmosphere. And sometimes you need to do that, but I think we lose sight of what the other side of it is as well.
Yeah. A corollary to that question is we know from studies, specifically the ones done by Roland Griffiths and all at Johns Hopkins, that showed that the mystical experience is protective in some way, is healing in some way.
I've written a lot about that. I gave a talk at Psychedelic Sciences last year on the mystical experience. And basically, my sense is that the mystical experience allows us to touch our true nature. And that when we touch our true nature, we come out of it with love, compassion, forgiveness, understanding, and a deep sense of gratitude. And that is our true nature. And that the mystical experience is been sort of universally experienced around the world in cultures, different religious traditions, with and without psychedelics, with shamanism, with fasting, with extreme exercise, with meditation, with nature, with pilgrimage. There's so many pathways to get there, but in the end, even near-death experiences, the commonalities abound. And the core element of the mystical experience is the sense of unity and the sense of deep connection. I had a mystical experience in 1983 that still sits with me very strongly today. And I think the question about why do psychedelic sessions, psychedelic encounters create durable change for people with a dose or two? The question is because we've been locked in this neuroreceptor suppressive model for so long that we don't understand what an evocative model or transformation or true healing is. And that when people connect with themselves very deeply and have a connection, a sense, an experience of reality that is so penetrating, so real, they're transformed. And once you've had an experience like that, it changes you. Your view of the world is different. A lot of studies now, Timmerman and others, are documenting that it shifts our metaphysical framework. We move from a place of materialism to a place of either panpsychism, idealism, but we move away from materialism to other models that are more accepting and expansive. And that's because we've been trapped in this materialistic frame for 400 plus years. And this experience, a mystical experience, is the opposite of that. It's expansive, it's truth, it's reality, it's validating, it's core, it's relational. It's healing, but in its essence, it's love. And that's the message that people come out of these experiences with, is that it's all love. Michael Pollan, in his book, How to Change Your Mind, he said, it seems trite, but what I came out of these experiences with is it's all love. It's just that simple. And, this is the core element, the perennial philosophy. This is the core of all our great religions, is it's love and care for each other. And I think that's the power of psychedelics, is they give us the opportunity to touch and taste that. It's not imposed. It's an experience that comes from inside us that allows us to let go of the false self that we've created, that our culture's created, that healthcare has created. And it allows us to embrace something that's more real. One of the fascinating things about psychedelic research, and that this is where classic psychedelics are different than ketamine, is people, when they have a psychedelic experience, they will validate on average that this felt realer than real. You have experience with ketamine, you have experience with other drugs, it doesn't seem realer than real. But classic psychedelics, and they have this power to help us get closer to the mystical experience. They have this ability to let us touch a deeper reality. We penetrate the veil, we go to something deeper, we see our true self, and we see reality as it actually is, and not in the very constrained, limited, dysfunctional, desiccating model that has been created and that we participate in creating for ourselves. I think that's the challenge. We have to understand that we're an active participant in this process, but we do have agency. And when we experience something that feels realer than real, we are changed.
Part of what I have witnessed is over the course of my 5 years here in practice, thousands of patients who have come through, is that they may get better. They may feel better. They may feel emotional. They may have that sense of empowerment or connection to that true self. And then they step out of the treatment into the world, and their identity that they had created and the people around them, the constructs of how they were living, doesn't fit anymore. And they struggle with that new ways of thinking. And I tell patients, there's an architectural change that can happen with treatments. Your brain is going to change. How does that fit, in your understanding of what might that feel like, say, when you work with your family or work with your children or at work? And because it's like when you lose weight, you're seen differently. You lost 50 pounds and people look at you and you may feel somewhat the same, but everything else around you has changed and your outlook may have changed as well. And that becomes the challenge, in their next phase of their growth. And I want to say growth, but I can see that also be a relapse.
Yeah. And I think, one of the challenges of working with ketamine is that people will have a little bit of a taste of this, but it doesn't tend to be durable in the same way that it is with psilocybin. And I think that's because the ketamine shuts down so much of our cortex that we don't really have an immersive, full-body, reality-based experience the same way we do with classic psychedelics. There may be other reasons, but that's just a hunch. And so I think, the challenge is for people, because I think we all can have tastes of this experience, even without psychedelics. I mean, we have a moment with a patient where we feel so deeply connected, so just linked at a deep level. And it's interesting is that I found that when that was happening with patients with me, sort of inevitably tears would come to my eyes. And it wasn't out of sadness, but it was just out of the power of the experience. And we have these moments, but it's so easy to leave them behind and get distracted. And I think one of the things of work with ketamine, of work with psychotherapy, of work with medicine in any way, is to take these kernels and try to build something around them, try to build some connection, some links, some validation, some understanding. It's just that psychedelics often give us such a full and robust dose that it's a little bit easier to work with, but that doesn't mean it's unique to psychedelic medicine. And I think we can be doing spiritual medicine in any way, in any realm. I have a buddy, a dear friend, also a child psychiatrist, and he loved everything about holistic medicine, but he really didn't change his practice that much. But his heart changed, and the people that he connected with were so deeply moved by how he approached them and just who he was. And that, he wasn't using fish oil or St. John's wort. He was still using Prozac and Depakote. But he connected with them on a deep spiritual level, just in the moment and just with who he was. And so it just reminds me that the instrument that we are is more important than the tools we employ.
Can I bring in a question about You mentioned, and thank you so much for that explanation, because there are ways of approaching that mystical experience that are within our grasp every day, specifically through our breath. Holotropic breath work is one of those ways in which we're basically blowing off so much carbon dioxide that it's changing the pH in our blood, and it's actually changing the sensitivity that we have to exactly what you just mentioned, to the mystical experience. It opens us up and our whole body. So this whole conversation has led us to the place to recognize that this is our whole self. This is us reclaiming this sense of greater humanity, kind of opening up the idea of who we are as humans beyond those frames, that the Descartesian frames that we've been living with for 400 years. Now we're kind of entering into a Spinoza realm, right? They both had two different ways of looking at things. And so we are now in this, kind of recognition of being greater than just this. And so in your experience, you've traveled, you've talked to different people, you're hearing things. Where are some of the loudest signals coming from on this planet to reclaim this? And who shall we listen to? And with this, I mean kind of like, you've encountered different medicines. Lots of different medicines come from indigenous peoples and practices. And so the psychedelic movement is not just about the medicine and the science. It's also about this kind of practice that's been part of our ancestry and heritage for millennia. And it's a reclamation in some ways. Can you speak to a little bit about where we are right now in that kind of going back to, and how critical it is that we maintain some of those practices, because they are being eradicated? The Amazonian jungle is just being decimated, and we may not have this pharmaceutical, the planet's pharmacy is the Amazon. We may not have that for much longer to discover. And so, you've traveled in those ways, and I've read these books, and, every time I read about what's happening to our species, right now, with just the window that seems to be closing around our ability to connect with that part of our humanism, that part of our greater humanity. And I feel like, as we head in deeper into the 21st century, there's this real importance of why that connection matters. And I'm kind of thinking of the greater reason why we're here right now, to really connect with the fact that the value of a human being doesn't depend on whether they live in a city or a Western country or a war-torn nation. Every human is capable of this. And I feel like when we talk about psychedelics, we only talk about the kind of privilege of getting in, into those spaces. We don't really say that this is actually a democratized experience that anybody can have given the right conditions, and how that may be a human right in some ways, is to touch that, to have the ability to touch that, to have the resources to engage in this. I mean, I would, at this point, sometimes I meet 70-year-olds who have never had a psychedelic experience, and they're, dealing with mental health issues, and they come in and they go away just so sad in some ways for never having been able to connect with this side of themselves, that it just speaks to me of how urgent it is that we do this. So if you can speak to some of that.
Well, number one, this sense of earth connectedness, this sense of, I think, deep connection we talked about earlier, like with the mystical experience, that when you have that, you appreciate the earth, the biosphere, our whole human ecology in a much deeper way. And there's actually pretty good evidence now that psychedelics do enhance our sense of earth connectedness and even our sense of anti-totalitarianism. It extends to the political ecosphere as well. And, I think it's easy at this point, both politically, ecologically, looking at pediatric mental health, we can look at a lot of different indicators that are setting off sort of red alarms, fire alarms that are going off in all these different places. But I think, that's part of our call to action, part of our call to awareness. And I do think that the way that things work in the world is that often destructive trends accelerate before they implode and transform into something else. And I think that is what's happening now politically, is that things are accelerating in a destructive way. But I have the sense of the yin and the yang of it all, that on the other side of it is something perhaps even more beautiful than we can conceptualize, but that we have to go through a destructive phase for that to happen. Maybe that's Pollyanna. Maybe that's blind optimism, which I have been accused of it many times in my life. Look,
my question, why can't we teach this to children? This way of being and this way of accessing their spiritual self, which they're not too far disconnected from just yet. Most children, at least, when they're born and as they grow, are consciously aware and very in tune with their surroundings and what their exposures are. If it's done correctly, can be our future, and teaching them the access of maintaining that spiritual sense of what healing is in that spiritual and emotional state, and teaching the methods of that. I mean, I'm not talking about dogma or religion. I'm really just talking about divine connection and trust.
It's like in Star Trek terms, I think that's our prime directive as parents, right? And that when we step outside that, whether it's in the school setting or in the clinic setting, or whether it's books or podcasts or whatever sort of educational venue we're doing, every step of the way that we get to broader and broader audiences, it gets harder and harder. And certainly in our sphere as our nuclear family, as our extended family, those are the ways that we can be of most use. But I think certainly role modeling the path that we want to do and embracing it and validating it in others. I've always been a fan of social emotional education, the model of working with at-risk kids and teaching them about emotional expression and emotional fluency and anger management and problem-solving skills and communication. I mean, that makes just such perfect sense for me, but in today's political climate, that's not really going to happen very much. What I see and what I've seen coming from New Mexico many years ago, when places are poor enough or distressed enough, they will embrace these tools. But once you get into more resourced and privileged settings, there's enough disagreement that it becomes very difficult to have any sort of linear trajectory with this. And maybe we get there at some point, but I've realized that what we can do is we can educate our children, we can educate our families, and we can teach as professionals what is in our heart and share, and we can teach the parents that we encounter and the adults. And sometimes, it's adults needing to parent other adults, because that's what we're in such shortage of in many ways. So it's a challenge, and I think we have to understand that we wish the opportunities were more expansive, but that's often not the way it is right now.
Yeah. Thank you so much for that. And as we're kind of winding into the end of the hour, I really want to ask you our curious question. We always leave our guest with a curious question. What are you curious about? But because it's you, I want to actually ask you about the future of psychedelic medicine, because I know you are at the forefront of creating these systems, envisioning them, recognizing what parts need to come together. And I'm always very curious to hear where psychedelic medicine is going from that ground floor level, not the 30,000 foot level. I think 30,000 foot, we've got lots of people projecting lots of different things, but like in that relational, we're on the earth, we're relating to each other, we're in these circles of relationship, of self, of family, of community, of nation, planet, and just encompassing that. Where can psychedelic medicine take us, and what are you curious about? What are some questions that come to your mind?
A number of things I'm curious about. I guess that probably defines me as much as any trait, maybe other than impatience. But I'm curious about what tools are synergistic with psychedelic medicine to bring about healing. And I think we can talk about, nutrition and making the body a less inflamed place and bringing diet into balance. I think those things give us more depth and traction with psychedelic medicine. But I'm also curious about things like, does TMS create an enhanced neuroplasticity option? What kind of spiritual practices as a prelude to psychedelic medicine, whether it's chanting or singing? I've been really profoundly intrigued with vibroacoustic beds and other sort of modalities that may just help us drop in a more deep way. We're using photobiomodulation at our clinic, photobiomodulation helmets, and really seeing synergy with that, with ketamine. And I think I'm intrigued by Spravato and having broader access to the population. We just brought it on at our clinic a few months ago as we stepped back into insurance. And I'm curious about what TMS, Spravato, vibroacoustic beds. We're now looking at whether certain chemicals, such as cycloserine, other chemicals, whether they have synergy with psychedelics, with TMS. And so what do we do to enhance people's ability to change and grow and open? And these are just tools. There's a finger pointing at the moon, and let's not mistake the finger for the moon. And so our goal is wholeness, is spirit, is contentment, it's peace, it's relationship, it's love. And these things are all just tools. And 50 years from now, we'll be using other tools. And these will have come and gone in some ways, I think. But I think it's always striving for the moon and not the finger pointing at the moon.
Yeah. So just to answer maybe some of your question or curious, I have the same curious questions as you with TMS. We are using QEEG guided TMS at our center, and we do the before and after. So we do their baseline EEG, and then we track their response with TMS and or ketamine with the QEEGs. And you can definitely see change and evolution of function over the course of their treatment, which is pretty amazing to see, whether that is some part placebo effect, whether that is just patients feeling connected and heard and listened to and treated with kindness and respect as they come in every single day. It's such a beautiful experience, and they enjoy coming to the point that I wonder, like, this would be very hard for me to come in every day, 5 days a week for 7 weeks. But, the neuroplasticity effect in the brain is possible. There's ways of seeing that and applying that. And I didn't.
Beautiful. Are you using wave neuroscience?
Yeah. We're using a Brain Master,
Oh, okay.
the dry EEG cap.
Well, I may need to talk to you offline about that a little more.
Yeah.
But,
I'm happy to help you through that and guide our processes as well and share to the notes and what we've been doing. So it's been a year almost now. And I'm very interested in publishing some of the data with that. We actually give our patients a certificate at the end of their before EEG and their after EEG, and they look at them and go, what?
Well, you two are just too curious. That's just it. Just too curious.
We're just too curious. We don't stop. No, part of it is there's so much to be curious about. Their mind continues to expand the world and knowledge. Of course, what impacts us, what's impacting us in this place right now that we're in is that we're treating trauma, and yet there is still more trauma.
Yeah.
And that's the sad part of this work as well, is that how do we get ahead of this? And how do we really, and as a pediatrician, I will say, just as a teacher, I wanted to be a teacher. Growing up, my father wouldn't let me become a teacher. I still feel like I want to teach, but we have to teach. We have to be out there. And
You're here.
Yeah,
You're here.
that's it.
And I think we also need to be so curious and look for solutions and look for options.
Yeah.
But I think we just need to also revel in the mystery of it all.
Yeah. I just wrote my first prescription for cycloserine. I was looking for a compound, and then I said, I think I'll just write a prescription and see if I can get it filled. And lo and behold, it's there.
Nice. Nice.
Well, I'm
see that.
curious about that too. So
Yeah.
here.
Here.
Beautiful. Beautiful. I definitely want to bring in the element of personalized medicine that you guys are talking about. So maybe we can extend the conversation a little bit. You guys have just mentioned a couple of different elements. And we have seen this consciousness in the psychedelic field as to, okay, there's the medicine and you do the medicine, and then there's the preparation and integration. And what we're talking about as physicians is like, okay, you've got that, but how can we layer on the nutritional, the biochemical, the genetic, the neurobiological layer to enhance the durability? That's the one word that comes to mind, because ketamine, it's the only one that's legal except in Colorado, where you are doing ketamine, psilocybin ketamine with your patients and just living in the future at this point. We're in California and only practicing with ketamine. And you mentioned cycloserine. What other tools are coming on the horizon? Because this is we're in a biomedical explosion in some ways of tools and techniques. Mm-hmm.
What I see is that prescription psilocybin will probably be here within 12 to 18 months, and that will be nationwide. So that's through Compass and likely USONA at some point soon after that. Yeah. I do think MDMA is coming on, even though the FDA decision slowed it down. Nobody at the FDA thinks that it will be ultimately denied. It's just been delayed. And so MDMA is also coming. But we have these state processes, a lot of curiosity about Ibogaine. Ibogaine is challenging because of the medical cardiac risks. And I know in our state, our law makes legal Ibogaine, psilocybin, ayahuasca, DMT, and mescaline. And the state has just decided they're going to begin exploring Ibogaine in a regulated model, which I think is challenging because the Natural Medicine Health Act in Colorado is non-medicalized. So it's kind of a oxymoron conundrum a little bit, but they're pursuing it, but it'll probably have some sort of medical overlay. So these things are coming. A 5-MeO is likely coming in the next few years. We hope to be working with that in maybe a harm reduction model in the very near future as the regulated model gets up and operational. So I think a lot of things are coming. And at the same time, we're seeing all this stuff with Spravato and TMS and QEEGs and a whole sort of brain precision side. And then we have the functional medicine side. And, what's nice is I see that integrative medicine and psychedelic medicine come from the same roots, the same philosophy, the same core beliefs. And I think this is a necessary marriage that is increasingly going to happen and lead psychiatry and mental health down a positive and productive road. So I feel very hopeful.
Yeah, I love this word of transdiagnostic. People have mentioned that psychedelics are transdiagnostic, and that breaks down the DSM completely if we're saying that they're transdiagnostic.
Well, love is also transdiagnostic.
There you go. Touche.
And your article on love, you're writing an article on love, I believe.
Yeah, I've got an article out to Frontiers in Psychology on love as a phenomenological indicator of relational coherence.
Wow.
Beautiful. Thank you.
Can't wait to get my hands on that.
Yeah, I feel a lot of love here. And gratitude for this wonderful conversation and for the time spent. Thank you so much.
Yeah. Thanks for the invite. My pleasure. Happy to join you.
So this is the era of curiosity. We want all our audience to stay curious and keep asking questions. We invite you to reflect about this journey and of your healing journey and the meaning that you find in listening to this podcast, and what questions you do have about lifestyle medicine, integrative psychiatry, ketamine, and the role of spirituality and mental health. Share your reflections or unasked questions in the comments. We'd love to hear from you. Your curiosity might inspire a future conversation on Too Curious MDs. So thank you for being here.
Thank you.
Thanks for joining us on the Too Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.